Hello, everyone, and it's so great to be back. I have some more material I'd like to share with you about the work that I do to help people who are challenged with a variety of different kinds of intimacy issues that relate to their sexuality, to their ability to be seen and heard, that have to do with being able to tolerate and enjoy being in their own skin and giving and receiving touch, all of these things, right? So that I've talked about in past videos. I want to talk today about what are the root causes to the different kinds of problems that I've encountered that people present with when they come to see me. And they'll probably sound familiar because these are disorders or a kind of deep discontent that most of us have experienced in one way or another. I will relate them to those specifically, the challenges that I encounter with helping people in terms of what they're bringing in, how they're being affected. So root causes, and I'll just harken back to my very first video, the opening video that does talk about where I share that I will be talking about root causes. So I went back and I saw that and I thought, this is a good time to do that. So I'm actually going to start by reading just so that I make sure I cover them all that I've experienced working with my patients. So they are anxiety, and we know that that's multifaceted. Shame, low self-esteem, different kinds of trauma responses, post-traumatic stress, fight, flight, freeze, and dissociative disorders, simply lack of experience, which often comes with a feeling of having missed the boat, late bloomer, lack of confidence. Sometimes the root causes can be in how a person has been indoctrinated through the way they were raised culturally and or religious ideas. And so often, and also sometimes people just simply have become numb, so they have a lack of desire. So I'm going to start this first one video on the series of roots, a root of the trauma, I guess I would call it, root causes. And we'll start with erection difficulties. So erection difficulties I've talked about in quite a bit of detail, and they manifest in many forms. So I'll just speak to the basic, and that is that, let's see, so, when someone presents with or says that their concern is about keeping, so that maintaining an erection at any point, then the first thing that I do is I ask them to please speak with a urologist if they have not yet and get tested, so that we can rule in or rule out any kind of medical condition. That said, I have really successfully worked with people who do have medical conditions, and the reason why this work can still help is because the psychological effects of having experienced erection difficulties because of a medical, could be prostate cancer, it could be recovering, could be blood flow, diabetes, many things, but because of this, particularly if they haven't had it their entire life, it really does a number on a person's self-esteem and sense of manhood and being, a person in the world where they really feel like they're valued, and it can really affect the deepest, kind of darkest parts of a person when they cannot, or feel like they cannot depend on their penis, cannot perform, quote unquote, like I've talked about before, perform, right? That's something that pretty much only men use in relation to sex. But anyway, back to root causes for erection difficulties. And again, this is a broad spectrum, and I'm aware of that. But we're going to start there. So let's see. I took notes because I want to be sure that I remember different things. So really what ends up happening is that so one way that I can also check with a person when I'm speaking to them on the phone about the cause of their erection problems is, if to just do a simple test, like, so when you masturbate, right, do you have difficulty maintaining erections? That's one clear way to tell, without going to the doctor, although it's still a good idea to go. And some people do have difficulty when they're getting, when they're masturbating or with pornography. And there's adverse effects of pornography that can help to create erection issues. That's another challenge. But barring that, we know that it really does affect. So what I know is that a root cause can also start to take hold when a person is in their heads and really at their wits' end about trying to control their penis, and it's not working. So they get into this self-fulfilling prophecy of fear and anxiety and shame, and it's like it's happened before, it's happened again. So I know I've mentioned this, but it really is clear that this is a real feature of erection issues and how they continue and become chronic, in that it's this desperation and real fear that, as an intimate encounter is starting to come closer in time, a person, many patients I've worked with will tell me that if they think that an intimate encounter is imminent, they'll avoid it. They'll just bow out, and especially like if it's on the third or fourth date, when they feel like, oh, now's the time I'm supposed to show up with an erection. So that's, I think, really at the crux of it. Let me just double check the negative self-talk, right, and how it just snowballs. So that is really broadly, but that really is at the real base of what happens for people with erection issues. And I'm going to actually stop there. Thank you.